Hello, welcome to Wondermous, a healthcare leadership journey. My name is Merikay Hunt. I am your host for this inspirational ride to meet amazing people. And today I want to welcome Jay Carmichael to the stage. And you know what? In healthcare, we're all going 90 miles an hour. So we're excited today that he's carved out time to be with us. And my name is Merikay Hunt, and I am going to share with you some inspirational highlights. So, Jay, before we dive in, why don't you share with everybody a little bit about your background and what inspired you to get into healthcare?
Sure. Well, thank you so much, Mary Kay, for having me on. I always enjoy the opportunity to share a little bit about my background. Interestingly enough, I didn't have a goal set out to be in healthcare. Quite frankly, I wanted to be a sports agent. Um, and then I was faced with a crossroads at I graduated college of stay and work in an undergrad in a local minor league team, or go and pursue an opportunity where I would get to travel the country and get to meet a variety of people. And so I took that opportunity because how often do you get to travel the country, right? From there,
Absolutely.
I got connected with a couple of folks and networked and built some relationships with people. And they began to talk to me and counsel me and mentor me on what was my life going to look like after this role and after this position. And they really honed me in on trying to find an industry that would be around for many, many years to come, that you could always find a job in. So I landed on healthcare. And what was really cool was seeing my transformation into making that decision of going into the healthcare industry, but also reflecting back to a personal healthcare journey that I had where, I had some unnecessary tests, I had some unnecessary procedures that could have been simplified had everybody just stopped what they were doing and communicated to each other effectively.
Sure, sure.
And that just kind of ignited the fire inside of me to pursue a drive of making healthcare simple and easy for patients, so that folks like me and others don't have to go through that complexity that healthcare presents. So that's how I got into healthcare. It's pretty cool, to find that fire and that passion for creating a better experience.
That's awesome. And when we first had our conversation, I think there were a couple of traits about you that I really admired. One of them was your genuineness and also your approachability. So, when you think about some of your leadership strengths, what have people told you over the years are some of your strengths?
I think that approachability and transparency and my willingness to have the difficult conversations and bring up the difficult situations. I don't shy away from conflict. I don't shy away from those crucial conversations. I think it's a necessary evil in order to get things done. And I do it and I try to do it most of the time in a respectful manner,
Sure.
but realizing that I'm not always perfect. So I think a lot of it is just having that transparency and that approachability. In fact, there was one time I was walking in the halls at my first job in healthcare, or in hospital leadership, and I could see one of our housekeepers was struggling to turn over a room. She was slammed, and you sensed it, right?
Mm.
And I stopped and picked up a broom and started helping her sweep the room and helping her clean up. And she turned around and said, "You don't have to do that." And I said, "Of course I do. Like
Wow.
we're all here to help, and if you're struggling, then everybody's struggling. So how can I help you be better, and how can I help you get through this difficult situation?" So I think those are some of the strengths that people have highlighted about me in the past.
Oh, I love that. And it made me think of the series Amsterdam, and the main doctor in the program goes, "How can I help?" That's one of his statements he makes. And I think you helped yourself early in your career by being open, listening to mentors, really leaning in and exploring those next steps. And to me, that's a confidence booster. So, who have you been able to mentor in your journey?
I've tried to mentor folks as much as I can. I try to identify high performers and
Hmm.
individuals who have a drive to achieve more from their life and from their career. And really, it's not so much a formal structure of it. And I think that's where people get hung up, is that it has to be a formal cadence and a um, a formal structure to it. And really, it's just having a conversation and providing some coaching on maybe a situation or a decision that that individual made, and how would be a better way to maybe approach it. Uh,
Hmm.
there was a young lady in our food and nutrition department that had for years and years and years wanted to be a supervisor. And I had observed her a few times, and just the way that she was interacting with staff, you could tell that she just was a stone that needed to be polished a little bit.
Wow.
And
I
so
like that.
I pulled her aside and said, "Hey, I have this book. It's something around emotional intelligence and how you can perceive yourself and how you perceive yourself, how others perceive yourself, and how you can interact with folks. And I'd like you to just take a gander at it. Here's my personal copy. Read it, and let's touch base in a couple of months and see what you've learned." And we did. And we provide some coaching, and I provided some coaching on maybe how I've applied those principles in my own life. And then it wasn't until like a year and a half later I saw her randomly in the hallway, and she had said, I just want to thank you because I actually took what you said to heart and applied it. And
Mm.
I applied for the supervisor position that came open, and I got it. And
Wow.
so,
Ooh, that
like,
gave me goosebumps.
yeah, those kind of, every time I tell that story, I get goosebumps on it, and those kinds of things are what, in my mind, makes leadership fun. It's those small moments, those small coachings, those small mentor interactions where you just set someone on the path towards personal growth and professional growth that excite me.
Absolutely. Well, and you made me reflect on a conversation I had with my father. I'd spent 6 years trying to get into dental school, and I didn't get in. I felt like such a failure. And he's like, "Mary Kay, you really should become a consultant because you've turned my practice around financially." And I wouldn't have even really thought about that if he hadn't have planted that seed. So sometimes as leaders, we have to first work on ourselves, and then we have an opportunity to influence and help lead and work on other people. When you think about some of your career journey, why don't you give people some of the stepping stones to where you've been after school?
Sure. So my first real big boy job out of college was working for my college fraternity out of Memphis, and that was an amazing experience because it was right in the gap of still in the college age experience, but also doing some professional work and consulting at a professional level. So it really gave me an opportunity to hone in some of my personal skills and professional
Hmm.
skills. And then I got a great opportunity to join a large healthcare IT company where I learned at a fire hose pace of healthcare from a 50,000-foot view, and
Hmm.
what were some of the challenges of facing healthcare providers. And through that, I built a relationship with my former boss, who was a client of mine. He liked my approach to healthcare. He liked my transparency. He liked how I was trying to roll up my sleeves and solve problems, and
Nice.
taking feedback of, hey, I understand that may not meet your needs, so let's figure out something that will. Um, and he was getting ready to build out his leadership team, and offered me a phenomenal opportunity to come on site, and recruited me away from that healthcare IT company, and I took in my first healthcare operations role. And there I got a front seat to anything and everything, some significant
Wow.
growth, some capital projects, recruitment initiatives, quality
Sure.
initiatives. Um, really learned a lot, and I'm extremely grateful for it. And it was a significant humbling experience for me as well.
Hmm.
And then after about 8.5 years there, I got the itch to, approach an opportunity in Illinois, and now I have the pleasure of serving as the president and CEO of a community critical access hospital here in Paris, Illinois. So super excited about where we're headed as an organization, and um, you know, putting my mark on this community and this organization.
That's awesome. So what are two or three key initiatives that you guys are focused on currently?
Wow.
I gotta know.
There's a board back here. It's got a bunch of stuff on there.
Is that
But
why it's blurred?
yeah, yeah, exactly. um, it's really just basic math. I don't need you to see that I can't add 1 plus 1. Um, no, this organization has experienced significant growth. About 3 years ago, 4 years ago, we had roughly 200 employees,
Hmm.
and we were a net revenue of 80 million or so, and now we're over 850 employees with a net revenue of 150, 160 million. And so
Wow.
with that rapid growth comes a lot of infrastructure and a lot of
Sure.
processes that maybe were kind of sped through a little bit. So I think
Right,
one of our
right,
big initiatives is kind of optimizing and creating some efficiencies.
right.
Um, but we're also in a community that has experienced some population growth decline, and so we've got to go figure out, where are the other, populations and pockets of patients that need services that maybe aren't in our home county, and how do we go grow
Sure.
out into those outlying areas. And then the third thing I think is I've challenged my leadership team. I've challenged the organization with, let's think outside the box. The traditional model has not worked very well for a number of years and is continuing to not work very well. And with most recent cuts with the One Big Beautiful Bill and the challenges that present themselves with that funding mechanism, we have to think outside the box. And so, what can we do differently to really drive better patient outcomes, create a healthier community, healthier population, and still create a sustainable environment where we can be around for many, many years to come. So
Absolutely.
we're really looking at how do we leverage technology? How do we change payment models? How do we look at different direct contracting models in
Hmm.
order to really, flip that curve and that the status quo, if you will.
And Jay, sometimes it's throw the box out the window, right? And you inspired me to think about when I was director of patient and family experience at a hospital. We were in High Point, North Carolina. We had Wake Forest, we had Cone Health, we had Novant, we had just a hop, skip, and a jump, Chapel Hill. Then we had Duke, and people will drive to a location if they feel like they are getting excellent quality care and when they feel like they are a person, a human. That to me, and building that mark, building that presence, will reach out to new counties, will reach out across. And the reason I asked you that is because that was one of the biggest challenges that I saw in our system is we had 63 organizational goals, which I thought was nuts. I was like, that's just too many. And from a consultant's standpoint, I thought it's got to be less is more. So I'm glad to hear that you guys are sort of, coming to the table and really assessing what are our top priorities and what do we need to work on, because we can't work on too many things at one time. It just dilutes our efforts. So, what do you think has been one of your biggest challenges that you have overcome as a leader, whether it's at your current organization or one of your previous opportunities?
Yeah, wow. I spent a lot of time reflecting internally on, oh man, I could have done that better. I should have said that in that conversation, have been better. I think, coming from the healthcare vendor side
Mm-hmm.
to the operations side, I think one of the biggest challenges I had was going from an individual contributor to a leader role
Sure.
and flipping the script a little bit on how do you how do you bring and motivate your team along with you versus just hammering in the solution and hammering in the issue. So I think a lot of change management principles and practices and bringing your team along with you has been some of the challenge that I had to overcome. I think
Yes.
there was a little bit of humbling there because in the individual contributor role that I was in, I was a hot shot. I was, knew it all, thought I knew it all at least. And when you get on the provider side and the delivery side, you quickly realize that you maybe aren't the smartest person in the room and you don't know it all. So
Mm,
there was a little bit of, sit down and keep your mouth shut and listen. And that
yeah.
was difficult for me. As I've transitioned into this role as president and CEO, now it's more of ensuring that I'm building the right team members, and that has been, not a challenge necessarily, but just it's something that's faced with, right? Is how do you really fine tune your team and motivate them when they have different competing priorities to perform at their utmost best opportunities, but also realizing that I'm under a microscope as the leader of this organization, and everything
Sure.
I say, everything I do, and everything that I you know think about, et cetera, could potentially cause some significant ramification.
Right.
I think that the challenge there is I've got to be always on, and sometimes that's not the easiest thing to do.
Mm-hmm.
And I think my approach is a little bit different. I think people are kind of shocked in this community that I am approachable. I'm approachable when I'm at work, and I'm approachable when I'm out in the community and I'm watching gymnastics or I'm,
Right.
watching my little girl dance or whatever, that I am approachable. I think it's really just trying to get back to my core values of I'm going to try to be a man of integrity, a man of grit, a man of respect, and a man of honesty. And as long as I continue to keep those in the forefront of my mind, I have confidence that I'll be successful.
Absolutely. Well, last week I had dinner with a friend from high school. We met through soccer. He played on the guys' team, and fast forward, we ended up working at a restaurant together. Well, now he's been the city planner in one of our communities, and then he took another position as city planner. And he said, "Mary Kay, I couldn't even go out to dinner because people would come up and just peppering me with questions." And so he purposefully is trying to live in a different community than he serves, which I find that interesting. And we were talking about boundaries, right? And because, yes, you have to always be on, but sometimes it's okay to say no, or to, put up that boundary of, this is the time parameter that I'm going to invest in this. And this is also the time that I'm going to give myself. So what do you do to kind of strive for that work-life integration so that you're not working 24/7?
Yeah, well, I appreciate you calling it work-life integration because I'm passionate about healthcare. I'm passionate about what we do, and so I think that's what makes me successful is that I am passionate about it, and I don't view it as I have to have a balance, right? The balance is that some days I work more, some days I work less, and some days there's family commitments, etc. So I have I made a commitment to get up and try to work out in the morning beforehand. If I don't, I definitely have a very rough day. I'm not my best. I'm not performing my best. So I've dedicated that, 5 a.m. is my time. It's my
Good for
time
you.
that I'm committed to getting up and, I may not work out every day. I may not, do the hard exercise every day, but I get up every day at 5 a.m. and I try to, put some kind of physical activity out there so that I can be my best for my team. Um, and then there are times when, you shuffle it around a little bit. So I try to get out of the office at a reasonable time so I can go home and spend, an hour or two with my phone away from me so that I can spend time dedicated to my wife and my kid and, be dad and be husband.
Awesome.
And I think those are committed. And then after they go to bed and they start their bedtime routine, then I'm back at it for an hour or so. But I have to be conscious, and you have to be conscious of your boundaries. Working out in the morning, doing physical activity in the morning energizes me for the rest of the day. And
That's
there is
awesome.
a point in time at night where I run out of energy. I can't think
Yeah.
anymore. My brain doesn't work. And so I know that at this time when it hits, I'm done. I cannot do anymore. And
Amen
so,
on that. I hear you.
yeah. So even if they go to bed and, it hits that time, I go, I can't function. I'm not going to
Yeah.
put out any good product. So I think it's knowing those and being confident enough to say it's okay if it waits
Yeah.
till tomorrow. Like it is
Absolutely.
going to be okay if it waits till tomorrow.
Your inbox is never going to be empty. I used to tell my kids, I'm like, Mama's clocking out.
Yeah, yeah.
I've reached my threshold.
I,
Mama's clocking out.
I gave up on inbox zero a long, long time ago. And quite frankly, a lot of it is that people just send emails all the time just for commentary, and a lot of it doesn't need a response.
Yes.
A lot of it's just more informational, and so I think trying to kill yourself and answer every email and get rid of every email is not not a worthwhile effort.
Yeah. One of my beautiful dreams is Control Alt Delete, and they're all gone.
I've been known to do that a time or two. Go back like
Hey.
the last
Yeah.
6 months, just delete it all. It's obviously not important now. Someone's just
Exactly. Jay, if it's that important, it'll come back, right?
100%.
Absolutely. Absolutely. So, one of my favorite questions is, if you could talk to your younger self, Jay, what words of wisdom or encouragement would you give yourself?
Ooh. I would probably tell myself that it's okay to not have all the answers. It's
Mm,
okay to slow down and stop and smell the roses. It's okay to ask for help because you're going to need it. And then, and it's okay to not know something, but just be passionate about trying to learn and
mm,
understand what the situation is. Read articles, read books, soak in as much education as you possibly can around a
hmm
given topic or a given situation. And then the other thing is just continue to pour into relationships and mentorships and find your network, your personal board, your supporters who can give you an unfiltered view of maybe some opportunities or
Sure.
flaws or some observations that they've had of how you interact, and be open to that feedback.
We become what we think about, and we are a product of who we surround ourselves with. So I am just grateful for your wisdom, your inspiration, your authenticity, to share your leadership journey with us. And I want to thank you again for being with me today on Wondermous, a healthcare leadership journey.
Yes, ma'am. Thank you so much for having me. I appreciate it.
You're welcome. And if you'd like to learn more about me and my organization, coachmk.com, visit our website. That's coachmkay.com. We partner with you to take your leadership and your team to the next level. Make every day count.